What a great panel I get to be a part of, and a few tough acts to follow. I want to get us on, I guess not back on time. We are on time, but I'm cognizant of the time, so I'm not going to spend a lot of time going through my presentation. This is just going to be a bit of a plug for something that my team at the BC Centre on Substance Use has collaborated with many of the members of our community to develop. So this is more moving into what can we do about many of the issues that we've talked about this morning. Like my colleagues, I do also want to acknowledge that this work has taken place on the unceded Indigenous territories of the Squamish, Tsleil-Waututh, and Musqueam people. As a scientist working at the BC Centre, or at a centre on substance use, this is really important to acknowledge, particularly in the context of the opioid overdose crisis or the poison drug supply, where we know Indigenous people are experiencing disproportionate harms, including overdose and fatal overdose. So this is what I wanted to plug. So there is a new and forthcoming, sometime this fall, module in the BC CSU, British Columbia Centre on Substance Use, Addiction Care and Treatment online certificate that was mentioned briefly by Leslie. And in this program, a pre-existing program, here's the URL, we've developed, members of my team, in collaboration with community, LGBTQ, or as we, 2S-LGBTQI+ centered substance use care learning module. It just so happens that this learning module is focused in the substantive area of substance use care, but it's really, I think, especially the first part that will go live this fall, is really translatable to other domains of healthcare, of the healthcare service delivery system. I'm going to skip through a little bit and just give you some details about some of the things we include in this module. We have some guiding principles. I think for those of you in the room, these guiding principles might just be de facto, that is how you ought to treat someone. This is really meant to be one of those strategies to get into other facets, potentially non-specialized facets, so of the healthcare service delivery system, for those who may not be trained in providing care for folks like many of us in the room. So we have a series of, I think 8. Is it 7 or 8? Should I push it again? Yeah, 8. 8 guiding principles. And with each guiding principle in the module, we've really focused on 2 things. One, well, first we describe what we mean by the guiding principle. And then we really go into describing how, for example, with the principle of being prepared, the individual, so the healthcare practitioner, can be prepared. But we also provide detail on how the organization is equally behooved to be prepared, and there are strategies involved in this module for that. In the interest of time, I'm not going to go through each of these principles, because like I said, I think many of us in this room wouldn't be particularly shocked by these. But I do think, you know, in conclusion, I think we have a lot of work to do to infiltrate non-specialized facets of the healthcare service delivery system. This is just one way to do it. When it goes live, I hope you know, it'll be taken up largely, but you know, there's work remains to be done. So thank you.